Hi, family. I am Dr. Mo, and I am your GPACT president and lead instructor. And welcome to the Senior Bowel Management Workshop for Caregivers. This is not a recording specifically from the workshop that we just had. I'm going to simply do a recap of that workshop, as there were a couple of people who missed actually a good amount of the information, maybe due to work, maybe due to other responsibilities. So I just kind of wanted to do a synopsis of what I shared in the workshop. And then if you want to dive deeper, you can always register and enroll into our higher caregiver senior bowel management certification programs for caregivers, healthcare professionals, and those that are colon therapists. And you can visit all of that information and read all about that information on our website at gpact.net, and that's gpact.net. So I would like to give you a little information about GPACT. GPACT started in 2009 with the intention of being a hub for colon therapists. And since then, it has expanded into a wonderful ecosystem for colon therapists to dive deeper with the industry of colon therapy. Now, when we started talking about the needs of those that we service, the senior care population came up. There was not a lot of information about senior bowel management outside of the clinical aspect of do this, don't do that, et cetera, et cetera. So we pulled our minds together and we created the certification program and the information for caregivers who are caring for those that are in their senior years. Very specific information that only a colon therapist would know about in regards to managing digestive health and wellness. So, with that being said, I'm going to share with you a couple of notes that I wrote down from the workshop. The first area that I want to go over is a couple of points in knowing what's normal for age-related bowel changes for the senior population. And there are 5 points to that. The first one is that in general, aging will slow digestion down. It doesn't mean that it has to halt or completely stop it. So, with that being said, there are very specific herbs that we would recommend that the client take on a regular basis. For instance, 1 ounce of aloe vera juice in 8 ounces of water every day will keep the body hydrated or keep the digestive system hydrated from mouth to anus. It's very gentle, very mild, and it's a soothing agent, meaning that if there's any inflammation in the elder's body, the inflammation will be calmed down by drinking the aloe vera in the water. Okay, so that's one way. And then also too, medications often contribute to specifically constipation and diarrhea, but overall digestive upset in this population. And so, one thing that you definitely want to know as a caregiver is that all medication is acidic. All medication is acidic. It doesn't matter what is being given to the client, all medication is acidic. So, as we age, we tend to get a little drier as we mature in age. The foods that we are given or being fed are a little bit more drier in nature, not so much alkaline. And then that will in turn create a lovely environment once you get the medication in the system to slow all the way down to constipation or try to be filtered by having diarrhea. So once you understand this, you can pre-plan meals. You can pre-plan medication. You can pre-plan the bowel movements. You can pre-plan when you give them, when you give your client herbs, minerals, supplements, and vitamins. You can kind of guide it because you know exactly how the body is going to respond. And you want to support that. You don't want to override it. You want to more so curate it for it to be the most gentle experience possible. And that's what our certifications do for you. The third is that reduced movement also affects bowel function. Oftentimes, the elder population is either bound to a chair or bound to the bed or bound to a very limited area of movement. The most important thing that you can start to implement in this population is breathing deeply. It's very easy to do. You just have them inhale through the nose and exhale through the mouth. This will create a lymphatic pump motion that has tend to die down just a little bit or might be non-existent. So once the person starts to breathe deeply and starts to inhale and exhale, it will increase circulation, thus increasing the circulation and blood flow to the digestive system to open it up so that the body can go ahead and let go. And then a byproduct of that is that they will rest very well at night. Yeah, so that's a plus. The fourth is hydration. Most people in general are dehydrated just due to stress, just due to our lifestyle, due to all of our responsibilities. The last thing that we are thinking about is hydration. So if you can keep that in the forefront of you caretaking for this individual, you most likely won't have any issues. And then the fifth is that over time, bowel movements just change naturally. I'll give you an example. For a woman that's still having her menstrual cycle, her bowel movements are going to be very different each week. Each week in the month, they're going to be different because her body is releasing different hormones each week based off of her menstrual cycle. So something similar happens when we go into a mature level of existence, is that our bowel movements change based off of our hormones. And that's a natural effect, but then you add on no movement or minimal movement or very limited movement, and then you add on a high level of dehydration, and then you add on medication. That is a sure disaster road towards complications in the digestive system that could be greatly avoided. Okay, so those are the 5 ways that you can really start paying attention to alleviating any challenges that might show up or might currently exist now. You can start bringing it back down to a level of balance just with those 5 points. And I do also want to say that dryness and stress equals illness. One thing that you definitely want to do is keep the nervous system calm, but that's for everybody, but specifically the elder population. Let's move on to the second point that I want to make, which is preventing constipation before it starts. And again, it's going to be the same level of awareness on your part as a caretaker. 5 points again, I'm just going to reiterate. Hydration, movement. The next thing that I want to actually include is fiber, regular bathroom routine, and responding to the urge instead of delaying. That's something else that I want to also share with you, is that many times elders will put it off because the restroom is just too far away and it takes too much to get up to safely get to the restroom. So they would just rather hold it or have an accident. Or maybe it's too much to ask of someone and they don't want to feel like a burden, so they will put it off or hold it. Or they are afraid that they might have an accident, so they don't do anything. They just sit there. So if you are a caretaker, one thing that would be a really good habit is every 45 minutes you check in with them. And I know in the beginning this is going to be a little tedious because it's every 45 minutes you're going to ask, restroom, would you like to use the restroom? Do you need to go to the restroom, etc., etc.? And you're just going to check in. After a while, the habit is going to kick in, and then they will say, I have to use the restroom, because now they understand that number one, it's safe for them to do this. Number two, it's not a burden. And number three, you are willing to assist and help. So that's a plus. Fiber. One really, really beautiful way to add fiber to the diet, again, is adding 1 ounce of aloe vera juice to 8 ounces of spring water, and you can drink that daily. I do not recommend making this drink cold. I recommend drinking it room temp or warm, like tea temperature. And then to assist with the fiber and assist with the digestive system from mouth to anus, you want to drink dandelion tea or provide dandelion tea. Dandelion, the herb itself, is such a lovely, lovely, lovely herb for the entire digestive system from mouth to anus. Is really good for the client's skin. It's excellent for their heart. It keeps the blood clean. I mean, it does a lot of different things, but specifically we use dandelion root tea for the digestive system. And what I want to share in conclusion with that section is that consistency works better than trying to put out fires. So if you add aloe vera every day, that would be a whole lot better than doing it every other couple of days in large amounts. If you do a little bit every day, the body gets very used to it. You build up the strength from the herbs that you're taking so that it will literally abolish and obliterate any type of challenges that might try to show up or that might try to exist. At least to keep a wrap on it and just kind of start diffusing it and going the other way instead of allowing it to grow in the body. The next that I want to talk about is how to communicate, or ways that you should communicate very easy and gentle with your client in regards to bowel management. One thing that I want to say is that everybody poops. Everybody poops. And there actually is a book out there if you would like to get that book and just kind of use that as an icebreaker. And the book, literal title is Everybody Poops. So it's a really good way to start talking about bowel management, the process of it, how we're going to start doing it, normalizing the conversation around bowel management and bowel health takes so much anxiety off of the heart space for both parties, both caretaker and the ones that are being cared for. The anxiety level comes all the way down, so you eliminate accidents, you eliminate the waiting, the bowels get stronger, and you start noticing a huge difference in attitude, because they're no longer holding on to all of this waste mixed with medication. It's going into the body and coming out of the body just like it's designed to do. This also reduces, again, embarrassment and shame. Like, there's no shame about it. But when you start talking to clients about bowel management, the first thing that they do mention is that I don't want to bother anybody because I'm so, it's embarrassing. They always say that. Everybody says that, actually. And if you're a caretaker, you know that there is no level of embarrassment needed when it comes to, or we should be implementing this fact as caregivers to the ones that we are caring for. I always like to encourage independence as much as possible, and that's independence away from herbs, mineral supplements and vitamins, and independence away from like physical walking apparatuses and things like that. If I can, if they need it, then they need it. But if they can stand on their own, if they can do on their own, then I like to encourage independence over being dependent. And then also to listening. And I know this sounds very easy, but most people rush this aspect of caregiving, which is listening to the client without an agenda, without rushing to the next idea, statement, location, etc., etc. I can't tell you how important this point of training is. The listening, just listening. The whole nervous system softens. The digestive system follows suit. And you have no more accidents. You have no more bowel incontinence. The client is resting. They remain hydrated. Medication gets decreased. It's a beautiful thing once you really, really, really start implementing these very small points. And these are just points that I wrote down in sharing the workshop. When you get into the certification, you are going to be, I want to say, overwhelmed with all of the ways in which you can help your client and all of the ways to make you that much more of a master at your craft. And in a few short weeks, if you're not already in demand, you surely will be, because you have mastered this. It's amazing. It's really amazing. And so I want to go over just a couple of points to let you know when you should call and seek for medical attention. And that's when you see blood in the stool, when you see persistent constipation. No matter what you do, the body does not open up. Time to call 911 or the main doctor. Severe abdominal pain and cramping. Stop, pull the plug. Unexplained weight loss and sudden changes in bowel habits. Like all of a sudden they were open and now they're closed, or the opposite way. They were closed and now they're open, but it happens like that. The body doesn't swing very quickly. It takes time. Maybe between 2 days to 5 days is a good window for a gentle transition. But less than 12 hours, absolutely not. Those are the times where you should definitely call in a professional. Okay. Now, some of the notes that I want to share with you, in addition to what you should take away from this level of education, is this. Bowel health is foundational to healthy aging. Small daily habits make a significant difference. Prevention is easier than intervention. And that you, the caregivers, play a vital role in digestive wellness. And education builds confidence. That's what GPACT can offer you when you look into our higher education or our CEU courses, or if you want to train with us to be a colon therapist and a wellness practitioner. You do matter. You do make a difference. And this level of education shows up as mastery in a very specific niche, which is the senior population. And so if this workshop gave you interest, it sparked your interest, it made you say, let me go deeper with that, I definitely invite you to visit our website and look at our senior digestive health certification courses. If you have any questions at all, feel free to reach out to me. I will give you my direct number, which is 562-682-0818. And once again, my name is Dr. Mo, and I'm your president and lead instructor. I would love to help you with understanding how to really, really, really make a difference in providing transformational care. Not just care, but transformational care. That's a totally different aspect of being a caretaker and being a colon therapist and being a wellness practitioner. So again, thank you so much for showing an interest in our workshop for our Senior Bowel Management course and certifications. You are definitely appreciated. And again, if you have any questions, definitely reach out to me. My name is Dr. Mo, and I am here to be of high reverent service to you. Visit our website, which is GPACT, GPACT.net, and my direct number is 562-682-0818. Until then, stay magical.